Welcome to Menopause Moguls Podcast, the Elevation Talk series, with yours truly, Dr. Joyelle. I am Dr. Joyelle, the Menopause Mogul, board certified OBGYN and business coach for Black women 40 and over. And my mission is to educate, embolden, and empower Black women and other women of color in their journey through health and careers. This is a space for Black women and other women of color to share their compelling trials and tribulations in their health and or in their careers and businesses. This is where we recognize the humanity of Black women and show how Black women continue to elevate despite midlife challenges and changes. Hello. Welcome back to another episode of Menopause Moguls. I have a treat for you all today. I am so excited to introduce you to our next guest on the podcast, Dr. Maria Uloko. Dr. Maria Uloko is a urologist who specializes in comprehensive sexual health, which includes the medical and surgical management of vulvar sexual dysfunction, vulval sexual pain, low libido desire, regenerative erectile dysfunction treatments, advanced erectile dysfunction, symptomatic menopause, atrophic vaginitis, urologic prosthetic surgery, Peyronie's disease, and hormone replacement therapy. She provides care for all genders from all over the spectrum. She's one of 6 urologists in the world. I'm going to say that again. She is one of 6 urologists in the world able to provide this level of evidence-based care. Dr. Uloko is a strong advocate of improving the quality of life of her patients by providing a comprehensive, compassionate, and inclusive approach to often stigmatized subjects. She believes in empowering her patients to take ownership of their sexual health by providing a shame-free space to ask questions and share their stories. She seeks to close gaps in disparities of care and implement systems that promote diversity and inclusivity. She's an international award-winning researcher on vulvar health, including her groundbreaking work on clitoral anatomy and director of the first vulvar sexual health urology clinic affiliated with an academic center in the U.S. Her research focuses debunking misinformation in sexual health and establishing fundamentals to further innovation. Her current focus is on vulvar anatomy, physiology, and its relation to disease states, epidemiology studies, and medical education reform. So in summary, she's a badass. So welcome to the stage, Dr. Uloko.
Hello. Thank you so much for having me. Wow. What a great intro. I love that. Thank you.
You are welcome. So happy to have you, Dr. Uloko.
So excited to be here.
Awesome. So I figured, we start off the year with talking about our vulvar health, our vaginas, like all the things, right?
Yes.
We have women who want to start businesses, want to pivot in their careers, do something new in these midlife years, and recognizing that not only their general physical health matters, but also their sexual health, their vulvar health, their vaginal health impacts how they show up in the world.
Yes.
So before we get deep into that, I just want to get a little bit of your story of how you even came to pick and choose urology, and not only just urology, but a comprehensive approach to urology.
I get asked that question a lot. So there's not too many Black women that are urologists, 0.02% of urologists are Black women. And so I get that question a lot. So it's, I would say the general answer is serendipity. I really had no idea what I wanted to do when I started medical school. I started medical school at 17. I did a 6-year program right out of high school. And, at 17, you really don't know anything.
Yes.
I knew I wanted to be a doctor, and that was about where it ended. And so through just a series of fortunate and unfortunate events, I found urology. I am a big believer that representation matters. So many urologists are men. And so
Yes.
Prior to that, I had no idea that women could even be urologists. It's just not a thing that I had seen until I went to a women in surgery conference. I knew my personality very much a surgeon, like to find a problem, fix it like
Yes.
immediately. And the person that I gelled with the most was a female urologist, Dr. Hadley Wood from Cleveland Clinic. And she was so kind, so nice, so well dressed, so funny. I was like, oh, you're a urologist? And so I went back home and I took my first urology rotation and I just loved it ever since. And so
Yeah.
that's why I'm such a big believer in like, you cannot be what you cannot see.
Yes.
And so that I live that in every single day. And then even within urology, it's very much just men's health from a sexual health standpoint.
Right.
And I knew I wanted to do something different. And so being a minority, being a really minority in this field, and then also trying to go against the grain was definitely challenging, but definitely um, all the right decisions were made um, to pursue this. Because I did after my training, I then went on to do a fellowship in comprehensive sexual health, which is actually the only program in the United States from a urology standpoint that teaches us about women's sexual health, vulvar sexual health, and honestly, that last year of training, my fellowship has taught me so much. It taught me more in that 1 year than I did in all of my 15 years in medicine. So that
Wow.
was that was
Wow.
one of the best decisions I've ever made. Um,
Yeah.
and yeah, I love it. I mean, I get to be able to help every single person along the spectrum regarding what their sexual health is, and it just feels really awesome to be able to do and help everyone.
Yeah, that is so awesome. So, so awesome. So let's jump into the disparities that we see in sexual health, as far as management and treatment, and just how women of color, Black women can, recognize, first of all, as far as what the problems can arise in regards to that and how they can ultimately advocate for themselves, in that process?
Oh, let's talk
I
about
know that's
this.
a loaded question,
That is,
and we don't
let's
have a whole lot of time, but we can try to fit it into.
yeah, no, I love this question, and I love it because this is one of other things I love about sexual health is because it merges my love of science and intersectional feminism and advocacy,
Yes.
and so when being able to treat all sexes actually has been one of the like my superpower because I'm able to see what happens on the men's health side, and I'm also able to see what happens on the women's health side.
Yeah.
And it wasn't until my fellowship where I really started to see those huge disparities because, again, from women's sexual health, we always thought it was the gynecologist, like they should be handling those things. And as a urologist, we handle, your kidney stuff, your
Right.
bladder issues, and
Right.
then the men's sexual health. It wasn't until my fellowship, and again, this was the only fellowship in the country um, and we're seeing patients that are like celebrities, like wives of sultans, like all of these like really high end patients. And I thought it was really fascinating because every single female patient had the exact same story of I can't get care. I've been suffering from these conditions for decades, years, over and over and over again. And that was the first time I was, tuned into those conversations and tuned into that story and that narrative and so I kind of kept chasing this down, and I went deep into history. I think history is one of the most fascinating things. It's like, why do we
Yes.
do the things we do today? You just have to look back and see. And I realized that if we look at the deep history of gynecology, it's not good.
No. Right. It's very
It's
dark. It's very
it's
dark.
very dark, and it really has not been like, although it's considered the women's health specialty, it is not a specialty that actually truly cares about the wellness and wholeness of women, and especially when you start adding like intersections, they really do not know how to handle it,
Yeah.
and that whole field was founded on this principle, and it's unfortunately still deeply ingrained in their training and education. So when we start talking about disparities, I'm talking about all women. like everyone with a vulva is essentially having some disparities in terms of getting care,
Yeah.
whether that's your menopause care, whether that's your cardiac care, that whether that's your like heart, brain health care. I mean, if we really look at research, and this is why I love research because I think research is advocacy. Research is how you make change, how you make progress. So if we look at the research that we have in terms of like just the fundamental understanding of women's bodies, it still hasn't been done yet. Like all of the research, when we think about the basic science, the foundations, were all done in male test subjects. So we
Yeah.
actually truly don't fully know what actually happens in women's bodies. And so this is the healthcare system that you're going into, is a healthcare system that hasn't done research on your body. And then if they have done research on your bodies, it's not typically Black bodies that they're doing research, that they've been consented to do research on.
Yes.
So
Yes.
learning all of this, the last 3 years after fellowship has been like one of the most eye-opening things of really diving deep into this. And and I think one of the most important things I like to tell patients is that you are your own biggest advocate. You know your body best. In medicine, we're taught that the doctors know your body best. And in
Yes.
fellowship, I had to unlearn that and realize that no, those people, like, they're seeing me for an hour max, maybe.
Yes.
They've been living in their bodies for years, decades
Exactly.
even.
Right.
Right. And so I always tell patients, trust yourself, trust your body, understand that the healthcare system truly does not fully know everything about you. And although doctors oftentimes position themselves like they do, they really don't. And so if you are going in thinking that something doesn't feel right, or you're feeling dismissed or gaslighted, that's I'm having pain. Are you sure? Are you,
Right. Right.
that
Right.
dismissal?
Yes.
That's a real thing that happens. That is and a lot of times doctors don't even know that they're doing it. And doctors, like, we are doing it because we don't know. We don't know how to treat you. We don't know that we need to be doing better. And so until we start learning, patients need to start trusting themselves and learning how to advocate for themselves.
Right.
And that really means educating yourself on the system, on your body, and tapping in and tuning in and trusting your gut.
Yeah, educating yourself about your body is so, so, so important. And um you've said this, I've listened to a couple of things that you've stages that you've spoken on, and you talked about the shame that we are taught in regards to our bodies. I've seen so many women, hundreds of women who come into the office and don't even look down there. Like, you want me to look down there? I'm like, yeah, it's yours.
Yes,
And like you said, being the expert of your body, you have to look down there in order to help
yes,
me help you. Right.
yes,
And you talked about in the segment that I saw you speak on about the cultural shame.
yes.
So can you talk a little bit about that and how we need to, as women, um, like you said, be the expert in not only knowing bits and pieces of your body, knowing all parts of your body, which includes
Yes,
you looking down there, being okay, like, oh, hey, doctor, here you go. Like, see, tell me
yes,
what you see, right?
yes. Yes, 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 yes. Yeah, that was again another shocking thing, or a very interesting thing.
Mhm.
When I started doing women's sexual health, it's fascinating because my male patients, when we have to do a genital exam, and just full disclaimer, these exams are really sensitive, and I
Yes,
completely understand the just general awkwardness of it, from a
right.
patient standpoint. From my standpoint, I'm like, listen, I've
Yeah,
seen
right.
like 40 of them today
Yeah,
already.
exactly.
They're like elbows to me now. It's
Right.
not. But I fully am also like well aware the situation, and so I always try to really bring a very soft approach to this,
Right.
and like really normalize this. But oftentimes, my male patients, when we have to do when we do an exam, it's not. It's always like, okay, there's that initial awkwardness that they feel, and then it's over. But
Right.
when I was doing, when I do a vulvar patient, a woman patient, every single one of them, when I said it's time for exam, they would apologize for their bodies. And I was like, why are you apologizing to me? What are you, like, this is part of our job. This is how I make you better.
Yeah.
This is an important part of your examination. And every single person did that. I mean, thousands of people were doing it. And I just finally realized, like, whoa, this is a cultural thing.
Yeah. Right.
Women have been so shamed, about their sexuality, their genitalia. It's and private parts should be private, but private parts should be private, but not shamed. And there we
Yes.
shame female genitalia, not necessarily male genitalia. And like, I always tell my patients and like kind of why I do a lot of the work that I do and talk about the work. Like, of like, if you close your eyes, you can picture what a penis looks like. Just close your eyes, you can picture that. If you close your eyes, you couldn't tell me what your vulva looks like. Most people could not tell you what their own vulvas
Mm,
looks like. And this is actually like a lot of people suffering from, really serious conditions like chronic pelvic pain, recurrent urinary tract infections, recurrent vaginal infections. When we do my exams, so I do my exams very differently in my clinic, where the traditional gynecologic exam is really actually very shame based. If you look at history, the only women that were getting gyne exams like that, it was based off of like if they thought you were sexually impure. So you only needed an exam if you were impure, and that was like a huge social taboo. Like, oh my gosh,
wow.
unclean. So, and even when we do our exams today, the way that we're taught, the traditional gynecology exam, it's all shrouded in secrecy. The doctor, you put a blanket on you, you lay back, you don't see anything. The doctor's the only person that sees things because it's so embarrassing. No, the way
Yeah.
I learned in fellowship is that you do the exam with me. Where either you have a mirror or we actually have a special camera called a colposcope where
Hmm.
you actually get to see everything. Like, and as we're doing the exam, you're doing it with me. I'm showing your
Yeah.
anatomy. I'm teaching you what your parts are, and it's really fascinating. A lot of these people suffering from these conditions and have taken decades, years and years to get diagnosed. I showed them their exam and I point out what's normal and what's abnormal. And they're like, oh my God, I had no idea it looked that way. And I was like, yeah, you're not crazy. One, your symptoms were real. You
Hmm.
like you can actually see it. And if you had only looked earlier, you could have said, hey, there's something not right here. Like, and
Right.
that's a huge that was really big for me to realize that so many people are so ashamed of their genitalia, and so many people don't even know what they're looking for, and what they're looking at. They don't even know what's normal, what isn't normal, because there are people suffering from these really very like debilitating conditions. And if they were just to look at their own self, they would see something's not right. But they're so ingrained, like such shame is so ingrained in them that they never even take
Right.
take a look. And if they do look, we have such poor sexual health education in the United States, I think all over the world really, on genitalia, on women's genitalia, that and vulvar genitalia, that even if they were to go look for what is normal, they wouldn't find it. So
Right.
they're kind of in this like it's hard. It's a tough thing, and that's actually why I created what I'm creating now.
Yeah, yeah. Yeah, that is so true. Like you said, we walk around and, you know, we have the idea that, what goes on down there is just we just ignore it basically, right? Like until
Yes.
something's wrong or something's happening, we're just like, all right, it is what it is, and then something's wrong. We're like, okay, well, wait a minute, maybe I should go to the doctor, but not really taking um the time to look down there because like you said, it's just, shame and like, oh my, I don't want to look, I don't want to see.
Yes.
And being like you said, becoming more of an expert of your bodies, especially as we're
Yes.
aging, because things are changing. And the earlier we look at it, the better, because we can notice that, as we're aging, like, oh yeah, that was there before. It looks a little bit saggier or something,
Yes.
because I'm aging. But again, being able to realize and recognize that, and then go to your doctor or physician to say, like, okay, I noticed this. Is this still normal? Having those conversations.
Yes.
So like you said,
Exactly.
just being a more of an expert of your body and just looking at all those parts. And I love that you are, looking with them and showing them what's normal, what's abnormal, so they can also recognize. So I love, love, love that. So talking about, you had I saw one of your Instagram posts and you had said 100% of people with vulvas will have a vulval dysfunction in their lifetime. 100%, everybody. Okay. Everybody. So can you just talk about just talk about some of those vulvar conditions, that you see, I would say, see more commonly, especially women who are aging in these midlife years that they need to be aware of?
Yeah. So, yes. So 100% of people in their lifetime will develop vulvar dysfunction. And the reason for that is because the vulva and the vulva, for everyone that doesn't know, is so everything, when you look into yourself, everything that you see on the external, like on the outside, is the vulva. The
Yeah.
vagina, we always want to call it the vagina, but the
Yeah.
vagina is actually just the canal on the inside. You actually don't see the vagina.
Right.
So, you can like call it the vulva, you can call it the coochie, you can call it whatever you want, but just got to figure out what it is. Like you just got to know it's all the external stuff, right?
Right.
So it's the clitoris, it's your labia, it's your vestibule, it's your opening of your bladder called the urethra. That's the hole that you pee out of. Many parts to it. And the interesting thing about the vulva, it is one of the most hormonally driven thing, meaning that, it changes based off of your hormones. So when, little people are born with vulvas or penises, so it's interesting when you're a baby, you actually don't have any hormones. All your hormones were given to you in the womb. And then when you're a baby, up until puberty, you have no hormones. So little boys, little girls, they're exactly the same in terms of hormonal regulation. They have none. Um, and then when you go through puberty, that's when your ovaries start producing estrogen. Testosterone is a very important hormone for all people, and actually, for the ovaries actually produce about 1,000 times, 100 to 1,000 times more testosterone than estrogen. So that's a fun fact for everyone, and
Mm.
progesterone. So that those hormones, all that surge of hormones actually causes the vulva to change and grow and elongate, and that's why you get that adult looking genitalia. And so, humans weren't living this long years and years and years ago, or not years, centuries ago. Humans weren't living this long. But now, with like advancement in modern medicine, like antibiotics, all of these like really great scientific discoveries that makes people live longer and helps people live longer, what then happens is that we're living much longer than our reproductive years. So your hormones continue producing until you hit perimenopause, menopause, then your hormones completely change.
Mhm.
So interestingly, because your hormones change and essentially stop producing, your vulva actually then starts to change. And your vulva actually starts to go back to what it was as a child. So it literally starts to shrink and shrivel, become inflamed because it needs these hormones to stay healthy. I use this analogy. I hate it, but it's the one that makes the most sense. I say your vulva is a garden. And it's so cheesy. It's so like too on the nose, but it actually makes sense. So your garden needs, if you're thinking about gardens, they need water, sunlight, nutrients, right?
Mhm.
And if you don't give water, sunlight, nutrients, your garden, you're not going to get tomatoes this year. But the beauty of it is that as soon as you give water, sunlight, and nutrients, your tomatoes will come right back. And that's the beauty of the vulva. If you give it, as you start losing hormones, I like every like human being that has a vulva that's perimenopausal, menopausal should be on low dose vaginal hormones. It is like Botox for your vulva, for your vagina, because as your vulva and vagina and everything starting to shrink and shrivel up, if you give it back the hormones that it needs, it literally changes back and like
Mm.
opens up healthy again, all of those things. So, those changes that we talk about actually correlate to disease. So when we start seeing those changes, oftentimes symptoms start arising. So things like recurrent urinary tract infections, overactive bladder symptoms, urgency, frequency, leaking, pain with sex, recurrent vaginal infections. All of those things start to happen because our garden isn't healthy, right? So when your garden isn't healthy, it makes you prone to developing all of these symptoms. But the beauty of that, and there are currently 85 million women in the United States, people with vulvas, that are suffering from these conditions every year. 1 million people are going to be going into menopause, you know, rarely, really soon, like on average, right?
Mhm.
So this is something that is like going to happen. It's one of those inevitable things, and yet the medical field is not doing a good job of telling patients about this, understanding that, these are all prevent things that we can prevent, and also things that we can reverse if we just give them low dose hormones. But because hormones have such a bad rap, because of bad science, because of bad media, people are so scared. So not only patients are scared, doctors are scared. So
Right.
everyone's scared. And I'm like here just being like, y'all need to stop being scared. The science has shown it's safe. The science shows it's effective. And the science shows that it's life-saving work, right?
Mm,
Life-saving
mhm.
medication. And not only saving life, but quality of life. If you are, you can't go to work if you're chronically having your urinary tract infections. You can't have a sex life if you're having UTIs. You can't these conditions debilitate you as
Yes.
well,
Right.
right? And so you can't thrive in your job, in your work, in your career, in your relationships if you're constantly suffering from these things. And so many women are going to their doctor asking and seeking help without actually understanding what they're seeking help for. They know something's wrong, but they don't know to like how to find the resources to get the care. And so, oftentimes they're just kind of like they're floundering and they're suffering and no one is helping them, and like this is something that I find so frustrating,
Mhm.
and something I really want to change because you know all of this misinformation, not only from the media side but also from the doctor side, is actually killing women and
Mm.
causing such detriments in their quality of life.
Yeah, yeah. I think that is, like you said, so important to, provide that knowledge in regards to, hormones in general. Like you said, there's so much misinformation and misleading things. And like you said, people are scared to death. Not only patients, but like you said, doctors also like, oh my God, just don't do it. Just suffer in silence and all the things,
Yes,
right?
yes,
So having that conversation, like you said, is so important for for women to be able to recognize like it is a safe option. It is an option, right? Like some women are walking around not knowing there's options out here.
yes,
So
yes.
having that conversation and being for them to be aware that there are options in regards to that. And I think that's a great lead into what you are now creating, Vulva AI. Please let us know. Tell us what that's about.
Yes. Okay. So this has been a passion project of mine, and just a labor of love because, as one of a few urologists in the world able to do what I do, my background is, I grew up an immigrant without really great resources to healthcare. And, I have always had a heart for serving the underserved, ran a free health clinic in medical school, all of the things. And so, I just am a big believer that healthcare should be affordable for all. And one of the interesting things is that if you do women's sexual health, it's been considered this like niche. And so you can kind of charge whatever you want, which also didn't make any sense because it's like, this is a huge part of the body. This is a huge part of your life. Like, why
Yes.
is this? Why do you have to, take on average, it takes about 7 to 10 years to get a diagnosis if you have a chronic pelvic pain condition. These patients are spending $7,000 to $10,000 out of pocket to get these diagnoses and even to get the
Mm,
right diagnosis, right? And so as I created my clinic, to be able to serve people within the insurance model
mm.
to prove a point. Like so many people said, when I said I wanted to do this, they're like, well, you can't give this kind of care in insurance. And I was like, watch me. I'm a big believer. Like, when you tell me I can't do something, then I'm probably going to go do it.
Exactly.
It's a problem. But I wanted to show that, like, first and foremost, in medicine, there's a lot of roadblocks, and which is one of the most frustrating things for me. So one of the roadblocks to getting good care is they say you can't do it in an insurance model. I proved I proved that you can do it in an insurance model. It was challenging. It was tough. I was seeing so many patients. I saw probably close to 2,000 patients in 2 years, which is unheard of. Like that's
Yeah.
wild. Most sexual medicine doctors see 3 to 5 new patients a week. I was seeing 30 a day. Like it was a
Wow.
lot. But
Wow.
in that time, and I had a year and a half waiting list. It was and no resources or support. And that's what happens when you do women's health. And it was interesting because I also had a men's health clinic and a women's health clinic and a vulvar and penis health clinic, and this is just kind of the fundamental problems. My men's health clinic is stacked, like such heavily resourced. I had such great support. My
Yeah.
women's health clinic, it has way more patients, not enough resources, and like
Yeah.
the institutions I were in, they were like, hey, keep doing a good job. And I was like, I can't keep doing this way. It's not
Right.
feasible. It's not sustainable. And so, in that, just understanding how the healthcare system works, understanding how, you know, um, dismissed women's health is. If you look at the people that get paid the least are gynecologists and pediatricians. And these are people like women and children, which are foundations of a society. they
Exactly.
get
Like,
paid
hello.
they
Hello.
get paid the least. And, I didn't have necessarily that same lens because as a urologist, taking care predominantly of men, I've always had privilege and I had no idea until I was like,
Mm.
let me do this women's health thing. And I was like, wow, there are so many
Yeah.
um, structural political things that make it actually really challenging to practice women's health. Like, I have such deep respect for my gynecology colleagues because they're doing amazing hard work and they're not getting the same compensation, the same
Right.
respect, the same resources that I as a urologist got. And I literally got to see that every every week in my two
Yeah.
clinics. And so that's like the like understanding that framework and then also hearing the same story of seeing those 2000 patients and I heard the same story over and over again. I was like, at this point, I'm a complex reconstructive surgeon and I'm spending more of my time talking at people and like debunking myths and
Mm.
like just like and it's always the same myths and that helps me to see, wow, there is so much misinformation, there is so little education, and there's so little resources for people with vulva to get information about their bodies.
Right.
And that lack of information then means that you can't be your own advocate. And
Hmm.
so I told every single patient, I taught them their anatomy, I taught them, like, okay, this is what's normal is, this is what isn't normal. This is how to keep things normal and healthy for your entire life. Do not let anyone tell you any differently. This is how you advocate for yourself. And that was such a powerful thing for to let people know, like, hey, you're going to be your biggest advocate. Like, the healthcare system truly doesn't understand your body and you are the only one that does, and these are the ways to help you. And so I would oftentimes stay up at night thinking of how to like handle these issues, right? The system that doesn't support women and the people that take care of women, the medical education, gosh, medical education, we
Oh,
actually
yeah. That's
literally don't get taught anything about women's sexual
exactly
health at
right.
all. So you're all like, there's an entire workforce of doctors that know nothing about your health, like your external anatomy and genitalia and your sexual health and your menopausal health, nothing, like even gynecologists included, right? And so, and there's only like a handful of doctors that can actually help you. And, so many of us are doing, we're educating, we're at conferences, we're speaking, we're having webinars, like we're trying to educate the masses. We're trying
Hmm.
to then educate other doctors just so that we can get more people to start, helping us help patients, because it's just, there's not enough of us. And,
Right. Right.
the math wasn't mathing. And I just would literally stay up at night being like, how am I going to see all these patients? 185 vulvas in the United States to this date over the age of 18. 100% of them at some point will have some dysfunction, and like maybe 30 doctors in the United States. Like it's wild.
Yeah.
It just wasn't working. And so I have a lot of friends in tech
Okay.
that it was really interesting whenever I would have problems or they would talk about problems. In medicine we always see a problem and then don't do anything about it because we say, oh, the system or this. There's always an excuse to not do something, which
Yeah.
for me as a problem solver really made it hard. It made it so difficult because I just realized I was like going up against so many barriers. And
Yeah.
in tech it was like, okay, here's a problem here, I created this a solution, and then now I can scale the solution to millions, thousands, all the things,
Mm.
right? And so I had this idea of, I can't, I'm like burning myself out, trying to educate patients, trying to educate doctors, trying to have a busy research career as well. And I realized that I was going to burn myself out. Like this was not a feasible way to do things.
Yeah.
And so I tried to figure out how I can scale what I do in my clinic to the rest of the world. So I created Vulva AI. What Vulva AI is, it's using AI and image capture technology to help people become their own vulvar specialists.
Mm.
And I frame it as not only a women's health Google, because so many people want to know about their bodies, but they don't know how to find resources. If you were to Google the vulva, like if you were to Google sexual health, female sexual health right now, you're going to get a lot of nonsense or a lot of medical journal. Like it really, like I have done it, and you're going to get so much misinformation that you just don't know where to start. Like
Mhm.
navigating the healthcare system is so challenging and it's so difficult, especially if you're a woman. And now you start adding intersectionalities in there, like, good luck. And so, in creating the Women's Health Google, just a place and resource for all things women's health, you can get evidence based, easily digestible information. I'm also creating patient care navigators, literally, how to walk you through. Um, uh, you know, getting your diagnosis. So, for people, it's really made for anyone with a vulva, but I'm starting with chronic pain patients,
Mhm.
recurrent UTI patients, chronic vaginal patients, chronic vaginal infection patients, or people, um, and anyone with a vulva, honestly, to start educating yourself and then to be able to then navigate the healthcare system. I think an informed patient is one of the most powerful patients. If
Yes.
you're coming into the doctor's office, because what's been happening, especially in women's health, especially with gynecologic and sexual health, patients know something is wrong. They go to the doctor, but they don't know exactly what's wrong. Also, your
Mhm.
doctor doesn't know. So it's the blind leading the blind.
Right.
Like, and that's unfortunately the truth of the situation.
Right.
And so I really wanted to change that narrative to have an informed patient. They're going into the doctor. They say, "Hey, doc, this is what's going on. It hurts here. This isn't normal. And these are the things I think it could be. I want to order these labs, and this is the treatment. Like this is like what I read. Can be the potential treatment." That is a whole different conversation than like saying, "Oh, I don't know, something's wrong, it
Right.
hurts, I'm not sure,"
Yeah.
and you can actually then have informed decision making. You can actually have a conversation. I always want to help patients feel and understand that they are their own biggest healthcare advocates.
Mhm.
They have so much more, patients have more power than they realize.
Right.
And I want them to understand that and take them from the start to finish. So, like, if you're someone that's been suffering from these conditions, before you go to your next doctor, before you see, another specialist, before you go to Vulva AI first, you put in your symptoms, you take your own picture, you learn how to do your own vulvar exam and examine your genitalia, you learn what's normal, what isn't normal. It then gives you, hey, it could be this, it could be that, it could be this. This is what this is. This is how you test for it. This is how you treat it. That is a whole different ball game, and
Yeah,
it's just going.
that's a difference between going in like, "Oh, you about to die tomorrow, so just start signing your will, getting everything together because your vulva is gonna fall off," and then
Yes, yes, yeah, no, because I realized I couldn't teach every doctor, and the thing is, the hard thing is I also couldn't get a lot of doctors to care, right?
that part.
There's a really
Yeah.
dismissal when it comes to women's health that I've never seen necessarily with men's health,
Yeah.
and you know, so it's up to women, it's up to them, like women, to start advocating for themselves, to change that narrative. And the way to start that is through education.
Yeah.
Now, when women start advocating for themselves, understanding their rights, and then making educated decisions based off of those things, that's going to cause a revolution. Like I
Yeah.
literally want to cause a revolution because, as it stands, there's no incentive for the medical system to change. It won't.
Mm,
It will not.
mm,
That's why I do research. I do research to help the medical system change. No matter what research I put out, no matter what research is coming out, the institution still isn't changing, right?
right.
And so it's
Right.
going to be up to the
The
patients to
patients,
make it change
exactly. Right.
because healthcare is now it's unfortunately now a business. It's
Mm.
we're not it's not this like
It's not patient
altruistic.
driven, it's money driven.
Yeah, yeah, exactly, right? But the thing is, and so we can actually use that to our advantage because, if we know basic um, business is that the customer is always right. But
Right.
the informed customer is always right because it's
Yes.
like the doctor's job to help you make informed decisions. But a lot of the doctors aren't doing their due diligence to even learn it themselves. So the customer is always right. The patient, it can be always right if you educate themselves. And so I just
Right.
really think that I want women now to take control of their gynecologic care. It's no longer put it in the in the hands completely of your doctor. You
Yeah.
can also be part of your own healthcare treatment.
Yeah.
And so that's what Vulva AI is. And we're going to be rolling out this year and fundraising as well. And so if anyone is interested, go to vulvaai.co and join the wait list. That really helps us raise and be on the forefront of being able to use this technology and these products as they come out.
Yeah, I love, love, love that. Congratulations. That is going to be a game changer.
Yeah, well,
Definitely a game changer.
I really hope so because, like I said, I can't teach every doctor, can't get a lot of doctors to care, but I can teach every patient. I can teach
Yeah,
every person with a vulva about their
exactly.
own vulvar health and anatomy and what's normal, what isn't normal. And, all of these patients that are suffering from recurrent UTIs, chronic pelvic pain, recurrent vaginal infections, they are struggling and overactive bladder symptoms too. Like if you're
Right,
someone that
right.
is constantly going to the bathroom and this and that, a lot of it is your vulva, and so many doctors are not taught on vulvar health. And I always say a healthy vulva is a healthy bladder, and you can only have healthy vulva if you have healthy hormones. And we are not taught any of this in medical school. I actually had to
Right.
go to train, like I had to do an additional year of training
Additional
to learn
training,
all of this
right.
stuff. And I'm
Yeah.
still learning. And this is the beauty of this field is that, you know, it is a little scary that we've been, operating on women. We've been treating them without fully understanding the science behind them.
Mhm.
So that's scary. But also, I look at it as this like really amazing renaissance of, hey, Beyonce, um, um, of scientific discovery. And how powerful is it that, like collectively get to be a part of that we
Yeah.
get to shape how healthcare is delivered and change that. And that is so exciting. And,
Yes.
um, I'm trying to start a revolution. I'm trying to start a
Yeah.
vulvar revolution because what we've been doing is not working and it's
Right,
only
right.
hurting women. And then you start adding intersectionalities on that and it's hurting those the worst. And so,
Yeah,
if
yeah.
Oprah can't get menopause care, good menopause care, none of us can. Like I mean, I can because I can give it to myself, but
Right.
like that's such a problem, like so
Yeah,
even the people with the most access can't even get this care. So
exactly. Yeah.
that's just showing you like that 360 lens of like, like this is a problem.
This is a problem.
It's a public health crisis, and but the medicine refuses to address it. It's like, or we're just not going to talk about the fire in the room. Like
Right.
the room is on fire. What are we doing?
Exactly.
They're like, it's fine. It's fine.
Right. And we have to be able to save ourselves, feel
Yes,
empowered to save
exactly.
ourselves.
Exactly.
Yes, yes.
Yes, yeah.
Yeah, yeah, most definitely. Love, love, love that. So, as the last question, in regards to women who are listening, and for order for them to be proactive, you mentioned low dose hormones, you mentioned educating themselves. Is there anything else outside of those two things for them to be proactive about their vulvar health? So, as they're aging, anything else they should be doing in the process in order to protect their health to make sure they're, aging gracefully down there.
Yeah, yes. So I look at your vulvas
Ah,
because
that.
listen, team, it literally starts to shrink down, shrink down. Like, I'm not kidding you. If you look at little ladies' vulvas and coochies, whatever you want to call it, it's shriveled. It's like shriveled, shrunken. It's literally a pinhole, and it never has to get to that. And that's
Mm,
why everyone's always like, why do older women get chronic UTIs? It's because their vulvas are on
yeah,
fire. Like,
right.
the skin
Yeah.
is inflamed, it's all shrunken down. So now, bacteria is getting trapped in there, and it's just this constant thing. And then
Right.
the amazing thing is that if you give it back hormones, it will literally change. Like, as a researcher, I am so excited about all the vulvar research that I'm doing, because I think the secret of life is actually in the vulva. No other tissue does that. Like, no other tissue. And vaginal hormones are like, it's like the Botox for the vulva. Like, it just keeps it youthful and and
Hmm.
and healthy. But you won't ever know that these changes are happening if you never look.
Yes. Right.
Oftentimes the symptoms happen much later than the physical changes. So the physical changes are happening and you're just living your life, and then all of
Hmm.
a sudden the symptoms start happening. The thing is, we could have prevented you from having all of these things if perimenopause, you start talking to your doctor, you start looking about low dose vaginal hormones, and they are safe. All studies have shown they are safe. Even in breast cancer patients, they are
Hmm.
safe. If your doctor tells you that hormones are dangerous, that should in your head tell you, oh, that person hasn't read, that person is not up to date. I'm not even kidding you. Like, I do not let your doctor take you off of your hormones because they said it's not safe. You tell them ask them tell me what the most recent data is, because they're using, oftentimes, the reason why people are saying it's not safe is based off of the Women's Health Initiative study that
Right.
came out in 2001, which has since been debunked by the scientists themselves.
Yes.
And so
Yes.
that doctor hasn't read since 2001. That's period. That's all it is. Like, so do not let them tell you that shit, because that makes my job harder. So, like, I always say, like, my job is made harder by other doctors because they're doing stuff that makes no sense. It's not evidence based.
Right.
There's a lot of feelings over facts when it comes to women's health, which makes me so annoyed, because as a urologist, we are so fact based. We are so fact driven. We have guidelines for everything, and we're constantly updating the guidelines. And when I started taking care of women, they're like, I just feel like it's dangerous. I was like, but what data
Where's
are
the
you
evidence?
using? They're like, well, I haven't read. They're just women, so it's like, why do I need to do science? I'm like, oh my god, guys, this is what you're up against. Like, I'm not even kidding you. This is what you're up against, and so this is
Wow.
why I say you are your own biggest advocate. This is your time to start knowing your body, having, like, finding resources, Vulva AI, to teach you about your body, so that when you go in, you are powerful, you are strong, you're not going to let them gaslight you. And these are the triggers. If you hear someone say hormones are dangerous, that should tell you, oh, they don't know, they haven't read. And you can even ask them, hey, what study? And then if they say the 2001 one, run. Like, go get it. But, like, I'm not, like, I kid you not, this happens all day, every day. Every single patient that I've seen,
Yeah.
the 2 years of clinical practice as a big bad attending, I heard the same goddamn story. I was just like, this is wild. And honestly, real talk, it's actually malpractice. Because if
Hmm.
you're doing things like that, that is actual, like, malpractice. And so many women have no idea. Like, I've had women in my office with true clinical issues. Like, you can see it from miles away. And they've been told by their doctor to, like, oh, just drink some wine or use olive oil on your vulva for an actual medical condition. It's like going into the doctor, you're having a heart attack, and they're like, hey, here's some Vaseline. Like, what? Like, that is actual medical malpractice. And, like, this is, but because women don't know, they don't know
Yes.
to advocate for themselves, they don't know that that's not okay.
Right. Right.
This behavior is just excused, and it just keeps happening. And, like, I want them to feel empowered to say
Yes.
no more, because you know what's going to drive the healthcare system to change? It's actually going to be patients, because it's
Yes.
not going to be, and it's a
Yes.
collective patient. It's a collective we,
Hmm.
because what, as a chronic pain specialist, what I've been, what I hear from other doctors is, well, that patient has pain. It's because they're challenging. I'm like, actually, they're not challenging. You just didn't get educated on how to treat them.
Right.
I wasn't until my fellowship. If you told me I was going to be a UTI specialist, a chronic pain specialist, I would have laughed in your face, because I like hated those things. But then I started loving them once I actually had an algorithm, a framework, a way to
Right.
work them up. And really, people like just fall into different categories, and it's really straightforward. And
Yeah.
because our medical education system does not teach doctors any of this stuff, and doctors then don't want to learn, because we think you don't know what you don't know. So many people, like, I thought I left residency being like, I know how to do all the things. I'm not going to learn that much in fellowship. My mind was blown how much more
Yeah.
I learned in fellowship. And I was like, wait, why isn't everyone learning this? How is it that
Yes.
I like, this is crazy. And like,
Yeah.
even the gynecologists don't know this stuff, y'all. Even your gynecologist, I teach the gynecologist about this. Like, this is this is the landscape that you're walking into. So
Yeah.
no one's coming to save you. You're gonna have to save yourself. And so I
Yes.
wanted to provide resources and make these resources for people to empower them to do these things.
Awesome. So awesome. So we're coming to the end of the conversation, unfortunately. We can talk for days about
Yeah.
this. So let's get into the rapid fire
Yeah.
questions. The first question is, what brings you joy?
What brings me joy? Um, a nice hot cup of coffee or tea, hot
Oh,
liquids. And then also like simple things like being with friends and family, being in nature, dancing Beyonce, Oprah, all the things.
awesome. All right. You probably already you said this probably, but I'm going to ask you again. What is one piece of advice that you would tell a woman who has issues in regards to their vulvar health in this landscape of the medical system?
Yeah. Educate yourself.
Yeah.
Find the resources to educate yourself. You're your own biggest advocate. You're not crazy. Nothing that you're saying is crazy. Most likely something is wrong. The system just doesn't know how to diagnose you. But trust yourself, trust your body. You know your body best. And uh, that's what I can say for now. And then trust Vulva AI, because
Yes,
we're
I'm
going to
about to
help
say
you.
vulvar AI is coming. So register, follow all the
Yes.
things.
Yeah, we're gonna help you learn how to trust yourself too.
Yes, awesome, awesome. And the last question, I am blank years old and my superpower is.
I am 32 years old and my superpower is thinking outside of the box.
Mm, yes, it is, girl. You are doing it. You are so doing it. Thank you, thank you, thank you for all that you are doing. Keep going because we need you. We need Vulva AI. So we will definitely put all of that in the, where can everyone find you on Instagram, Facebook? Where can
Yes.
they find you?
Yes. So my Instagram is Maria Uloko MD. I'm also on TikTok as Sex Med Ed, where I give educational content on predominantly vulvar sexual health. But my penises, my fellas, I'm there for you too. Don't worry. One stop shop for all things educational content. vulvaai.co is the Instagram for Vulva AI. www.vulvaai.co. Please join the wait list. These things really matter as we're raising funds to build out the company. I'm also on Twitter. Haven't used that a lot.
Yeah.
At Maria Coco. But yeah, yes, follow, subscribe, do all the things.
Yes.
Starting a podcast soon, also
Ooh.
called Salvaging Sex, and I'm going to be interviewing female founders on
Yay.
that work within the sex med, sex tech, femtech health space. As
Okay.
someone that's been in medicine for 15 years, and I'm going into tech and becoming a founder, it's a whole different ball game. And I just keep going into racist, sexist fields. I'm not going to lie to anyone, because urology, not like they're getting better, like truly. But like if we look at the stats, it's really not
Right.
fantastic, and medicine in general is just not it's not been known for its sexism and anti-racism. It's
Yes,
actually really rampant. And then going
exactly.
into tech and fundraising in VC world, where only 70, I think 70 Black women have ever raised $1 million in venture capital investments, and that's insane because
Wow.
I have male friends that have raised millions of dollars with 3 slides, and so it's
Oh my
so
gosh.
yeah, it's wild. So if someone that wants to build something for, women and women all over the world and people with vulvas all over the world, I just understand the lens and the scape that I'm going into. And I understand that to do this work is going to take the collective power of women banding together to build the system that we want. The system will
Yes.
not change until we force it to.
Yes.
So any support is so appreciated. Tell all your friends, tell anyone with a vulva, tell any man that knows a person with a vulva, like call all the people. Never stop talking about
All the people. Call all the people. And I will put all that information in the show notes for people to log in, register, get on the wait list, but all the things. So
it.
thank you so much, Dr. Uloko. It was so lovely to have you. And like I said, what you are doing is amazing. And I'm just going to be watching for, everything to continue to evolve into more amazingness.
Well, thank you so much for having me. And yeah, I love being able to tell people, what's the tea, what's happening, like what's happening behind closed doors, because it's affecting you, so you should know.
Right.
And so
Exactly.
yeah,
Exactly. Awesome. All right. We will see you next time. We'll probably have you back on so we can get more information about how Vulva AI is doing and founder and all that good stuff. So, yeah. Thank you. Thank you. All
thank you.
right. See you later.
Bye.
Oh my gosh, that was so amazing. So amazing. Please follow her. She is amazing. What she is doing amazing is amazing. So, um, as a woman of color, as a Black woman, it's so important for us to be more educated, to look down there because our vulvar health, our sexual health does impact us as we are showing up in the world. So, just so you know and remember that you are enough to do anything you are being called to do, but please remember to include knowing all parts of yourself in the process. Until next time, y'all, I'll see you later. Sending love and light to you all. Take care.